Hi, everybody. It's Dr. Amanda Cohen, and I'm here with, okay, making sure I'm recording. I am. All right. I'm here with one of my favorite people and doctors. He's actually my doctor. He's out in Boulder, Dr. Eric Dorninger. And what my purpose in creating this space is both of us practice medicine with our hearts. We want results. We want you to feel empowered. And there's a whole movement, even before the pandemic happened, where both of us really want people to reclaim their feelings of feeling safe again in their body, being free of pain, and working with people who really care about them and getting to the root of whatever discomfort or diseases their symptoms they're going through. And why I have Dr. D here, Dr. D goes by Dr. Dorninger, is I think he's brilliant. He has a huge heart. He's a wizard. I talk about him with my patients all the time. I'm like, I don't know, let me ask Dr. D. He knows. And he actually helped me through a lot of things. And I really want you guys to feel always, not even during a pandemic, of course, during a pandemic, to really focus on empowerment, patient empowerment, empower doctors, really getting to the root of what's happening. And so I just adore you, Dr. D. Thank you so much for taking the
Oh,
time
thank you.
to be here. And I wanted to sort of start with kind of on touching on what I just said, just about your practice and sort of that patient-centered, you're a health detective like me. And so I just wanted to give you the floor and just kind of talk about that, how your practice is very patient-centered.
Yeah, and you're hanging out with me. We review a lot of themes over and over and over again because my goal ultimately is to beat down healthcare to improve and change the model before I die. That's the goal.
Yes, I love that.
Show up, show up as a dad, show up as a husband, show up as a doc, but really we're in the experimental phase where what we're doing in our clinic is working. And what I mean by working is every year we get better clinical outcomes. And that's my only goal. If you ever see a practitioner and they're like, I can heal that, we heal that all the time, nothing ever goes wrong, they are just walk away, right? I'll sell you a bridge in Brooklyn, right? We get our butts kicked every single day because we take on mystery illness cases, right? We take on chronic illness. And there's two kinds of, I see three basic people in my practice. The majority is multi-system, multi-symptom illness. People have many symptoms in many systems. They might have migraines and psoriasis. We find a little calcified plaque, maybe vaginal dryness, all in one human being, right? And their life is turned into this puddle where I have to quietly say to myself, wow, like, is this quality of life acceptable for this person? And I want to get to know them. I know my agenda. My agenda is to get biochemistry, physiology working, ultimately producing chi, right? Without ATP, cash money, you cannot pay down debts for recovery, for endocrine meeting back up with the brain and immune system and everything getting back together. But it's got to be within the framework of their life, right? Is it a 16-year-old who will eat cleaner because they don't like their acne and they want a PR in their swimming team, right? Is it a 40-year-old whose brain is starting to slip and it's a dad who has 6 kids and wants to keep providing for his family, but he's starting to have a hard time finding his keys, right? Is it a couple that is desperate to make babies and it's just not working, right? And understanding that allows me to apply the hardcore rigor of diagnostics and treatment plan for the goal, right? And the goal for everyone is, I want to be able to make energy. I want to wake rested. I want my brain to work. I want to be able to have ambition and drive to do a workout, to shovel my old neighbor's driveway from snow, recover from that, so on and so forth. But where we get in trouble is this calling symptoms diagnoses.
Right.
And that's where we've talked a lot about that, where if someone says, hey, doc, my muscles hurt, and you say back in Latin, you have fibromyalgia. The patient should go Google and say, I looked at that, algia means pain, myofibrils mean muscle fibers. So I said in plain English, my muscles hurt, and you said back in Latin or Greek, hey, your muscles hurt, right? It's not a diagnosis, it's what you have, right? Naturopaths, acupuncturists are no better, where we can say, oh, I have gas and bloating all the time. We say, oh, you have SIBO, right? I did a breath test. You have elevated hydrogen levels or elevated methane levels or both, right? SIBO is small intestinal bowel overgrowth. That is what you have. It is not why you have it.
Right.
Why you have it is usually some issue with gut cleansing, gut motility. And we talked a little bit about that might be low T3 thyroid hormone from a myriad of reasons. Hashimoto's, destruction of the thyroid, hypothalamus pituitary thyroid axis being thrown off from anything from concussion to mold to other neurological diseases, T4 not converting to T3 in the periphery, which happens from anything inflammatory, right? So if you make antibodies to gluten, if you have psoriasis, if you have sleep apnea, if you have a toxic tooth, if you have moldy building, Lyme disease, you will stop turning T4 into T3, right? T3 is mandatory to set the wave of motility to clean the guts out, right? So again, I can use natural herbs. My prescribing nurse practitioner can use rifaximin to kill all that bacterial overgrowth. But if you don't get the gut motility right, you go on a SIBO honeymoon, and 2 months later, you're back in a Stephen King movie. We're back, you know, and you're all bloated.
The creatures are back.
Yeah. You know, just on that example, the number one autoimmunity, and I know how much you understand Hashimoto's and how much Hashimoto's we see in our practices, but the number one autoantibody, the other number one autoimmune destruction I see in my clinic is actually to the parietal cell. And that's the cell in the stomach that makes stomach acid. So people have rampant autoimmune destruction of their stomach acid producing ability in a lot of chronic illness clinics where people just aren't getting better. And you need hydrochloric acid for three major things, right? Breaking down proteins into amino acids, absorbing B12 through intrinsic factor, the taxicab that gets released, and absorbing minerals. Now, but we don't give hydrochloric acid the credit for being a profound immune barrier. So if you and I both eat salmonella-laden sushi and you have intact hydrochloric acid, you're going to be chilling, enjoying your sushi. I eat the same salmonella sushi. I'm off puking, and you're like, huh, Eric's off puking again. What's the deal? Then we learn I'm hypochlorhydric. I have low acid. When that salmonella came down, there wasn't hydrochloric acid held to burn that, right? And then that acid should set up a low acid environment in all of your tubes. So fungus and bacteria love to grow in alkaline environments, right? So SIFO, small intestinal fungal overgrowth, SIBO, small intestinal bacterial overgrowth, will set up in hypochlorhydrics all the time. And then patients come in, but I'm supposed to drink alkaline water and all this stuff. You want your bloodstream to be alkaline. You want your tubes to be acidic. My gyne teacher, Tori Hudson at Bastyr, phenomenal. She's kind of the guru of women's health in the naturopathic world. She formulates for Vitanica, and they made those yeast arrest suppositories.
Oh, I love those. My patients love those.
Oh, they're like, if you're doing women's health, you have to know Vitanica yeast arrest.
They're incredible.
They're incredible, and they're incredible because they obey naturopathic law, which is kill, but change the host, change the human, change the environment so that it's inhospitable for the problem to come back, right? So the number one ingredient, the leading ingredient in yeast arrest is boric acid, right? Ingredient number two is lactobacillus acidophilus. So you're trying to make the vaginal wall so acidic that yeast say, oh, I'm not going to live in Arizona. It's too hot. I'm out of here, right? So if you can change the environment, you'll deal with the problem once or twice. And then the third one is gallbladder, right? Bile ejection, a gallbladder that really dumps the bile, triggers motility.
Sure.
And we can reverse engineer this by people who have their gallbladder removed, cholestectomy. Now they don't have a catcher's mitt. Gall just means bile and bladder means bag. So their bile bag has been removed. So the phase 1, phase 2 liver detoxification just bile drips all day. And 50% of gallbladder removal patients will have bile dumping diarrhea because there's constantly bile dripping, right? And that's where that miracle drug we use in biotoxin illness, or mold and Lyme and all that stuff, cholestyramine, Welchol, that was actually formulated to mop up bile. And that's a great drug for post gallbladder bile dumping diarrhea. But a lot of our patients, the problem is not bile dumping, it's right. And we got to get those herbs sometimes to really get the gallbladder. And I should self-disclose, I own Roots and Branches Integrative Healthcare in Boulder. I teach for Apex Nutraceuticals. I don't own any portion of Apex, but I get hired as a teacher of the great Datis Karazian's lectures. And I say the great because he's a freaking juggernaut of assimilating and assembling peer-reviewed scientific literature with a nice functional medicine edge to it. And then I also do research and development for a CBD company named Blue Sky. And my favorite, again, I teach for them, but I don't get any royalties. My favorite gallbladder moving product is Bilamin from Apex. Leading herb is dandelion, and it increases bile flow. And we'll often add hydrochloric acid, correcting a thyroid and getting the bile flowing when we're batting third, fourth, fifth, sixth on a SIBO case, right? Because these patients want to pull their hair out because that gut's just not restoring. And we've seen really good work on setting the stage for healing from other practitioners, sometimes really good choice on which herbs or prescriptions to kill, but you didn't reestablish normal physiological function. And when we're working with people, that's my big jam, is reverse engineer anything. What would a healthy body do when connected to natural law? If we pulled you out of the Congo 500 years ago, what's going on, right?
Yep. And I think that's really, I can't believe you in, I don't know, 5 minutes summarized the whole process of the thyroid and absorption and elimination.
Yeah.
So I know that, people listening to this, we talk about immunity, and I think in a big part, most of the immunity comes with the gut. So in terms of really putting your best foot forward during this pandemic and beyond, what are some things that, because I want to talk about some things that we can do to strengthen our immunity, but I think that maybe someone who is taking long-term Prilosec might, can you talk a little bit about that? Or if they're having digestive issues,
Yeah.
maybe there's things that they could do. I mean, they could, of course, reach out to either of us, but maybe there's some things that they could do, things they could take, or exercises they could do about the vagus nerve to help support the digestion, to keep their immune system and detoxification and digestive system working properly.
Yeah, that's a can of worms right there. So I learned so much from docs I go out on the road and teach, and that's how we first met. Is I did a weekend that you attended, and then you came up like a buzzing bee with great questions, and I was like, oh my gosh, this person grinds every day in her practice. She's earnest, she's sincere, she's brain smart, she wants to do a better job. And we just kind of got in the sandbox and started learning from each other, and it's been awesome. But that question you just asked makes my brain go in 5 different directions. So
Sorry.
I'm gonna
just whatever question you want to answer.
Number one, but my whole point is, other docs that I pal around with, I learn from them all the time. I take things they've taught me, I refine it. I hit the ball back in this wonderful tennis match of, hey, let's all get better to do a better job with patient care. But patients teach me stuff every freaking week. And with COVID, it's been awesome because patients who I know and love who have medical minds will send me an article, and then I can take that to the peer-reviewed study and assimilate a lot of that. And when I was working with a patient on acid blockers last week, he sent me a paper that came out in 2018 that I was unaware of acid blockers linked to stomach cancers and other cancers in the body. And that's a whole can of worms where, again, Helicobacter pylori or H. pylori in the upper GI, not in the lower GI, not on a stool test, but on a urea breath test, only sets up because you're hypochlorhydric. Remember, you have to have low acid for it to be hospitable to bugs and fungus. But he sent me this paper. I'm like, oh my gosh. And everyone wants to point at pharma, right? But if you open the packet on an H2 blocker or proton pump inhibitor, right? Prilosec, Nexium, Pepsid AC, all those, it says not for use for longer than 6 months.
Right. And I
So
have
it's
people on
not
it.
pharma's problem, right? And I love proton pump inhibitors or H2 blockers to get us through a Barrett's esophagus or some short term, 6 weeks in and out if we need it. It's rare we need it with things like DGL powder and Repairvite from Apex, those kind of products, really helpful. But it's not pharma's problem. It's the patient gets hooked on the crack pipe of acid suppression, and the doctor never finds underlying causes for why reflux. And
Right.
then 6 years goes by, right? Now,
Right.
Canada did a study 10, 20 years ago already that showed 6 years on a H2 block or a proton pump inhibitor comes with more osteopenia, osteoporosis.
Sure.
And I said, well, what do we need acid for? We need it for mineral absorption, right? So eventually you're going to run out of 2x4s to build your bones if you don't have enough stomach acid to suck it up. But you asked about this immune system, and I want to go back for a second and talk about if we pulled you out of the Congo, right, 500 years ago, what are the 5 things, or we're both Caucasian, if we pulled you out as a white Gaelic Irish fisherwoman, and you as a white Gaelic
like
Irish fisherwoman, because Weston Price, remember, looked at 13 indigenous populations, white, black, brown, red, everybody, right? North and South, Native American Indians, the Bush Africans, the Maori, New Zealand, the Caucasian, Gaelic Island folk, and he found the same sinister pattern where before Western diet was introduced, which he called civilized diet, they had minimal cavities, no heart disease or rare heart disease, rare cancers, rare autoimmunity, no osteopenia, osteoporosis. And the Maori were the most impressive. They had one cavity. All he had was physical exam and a camera. This was in the 30s. No labs. Didn't bring along an X-ray machine or a 3D cone beam CT. And he saw one cavity per 2,000 per 1,000 teeth examined. 1 per 1,000. Now everyone had better teeth, but the Maori had these epic teeth. So he was trying to figure out what's the difference, because they didn't have flossing, even though we 100% support flossing. It's a way to stop heart attack and stroke. Good dental care is important. They had 10 times the fat soluble vitamins. That was the biggest distinction from the indigenous then and today. 10 times the vitamin D, 10 times the vitamin A, 10 times the vitamin E, 10 times the vitamin K2, which are all antiviral immune modulators. That's number 1. Number 2, they had dramatically higher levels of EPA, DHA fish oil. Now, whether that fish oil, in quotes, came from a wild boar eating truffles and then my arrow took out the boar, or a buffalo grazing on high omega-3 grasses, or an actual Copper River salmon going up the Portland rivers, these all were super high potency anti-inflammatory EPA, DHA. And that's why I said grass-fed beef till slaughter, because of the vitamin K2 and the EPA, DHA levels, is not only never caused heart disease, it actually helps prevent and treat heart disease. But once you feed that animal corn, you have now a very high omega-6 inflammatory fat, and you can drive heart disease. And again, perfection is the enemy of progress. Our household does the 80-20 rule or the 90-10 rule, where 80-90% of the time we're supporting farmers who do their jobs well, ethical raised farming, grass-fed to slaughter, so on and so forth, small businesses, many of them grazing. If you haven't seen the TED Talk on the Savory Institute, fascinating stuff on how animal grazing and eating meat could be what rescues our environmental atrocity. But my point is, you want EPA, DHA. Yeah, the Savory Institute, if you haven't seen that TED Talk, fascinating. They're based out of Boulder, doing really good work. And I'm the son of a butcher, but I'm not like some like, you got to have meat guy. You're either a thin, lanky body type like me, and you need to input cholesterol, which only comes from animal products, or you're a more substantial body type and you can actually do quite well being vegan, right? So, not to shit on the game changers, but this is the issue with society when we pick teams and get myopic.
Yeah.
The reality is always in the middle, and everyone has good things to say, but eating meat that is grass-fed till slaughter is a anti-inflammatory meat in regards to this EPA DHA. The third one is glutathione, and we've heard a lot about glutathione as an immune modulator. I'll talk a little bit more about that. Then we have probiotics and short-chain fatty acids. Those are the 5 things that we saw in the indigenous. Now, the indigenous might have died of...
That's vitamin D. Oh, let's repeat it.
Fat-soluble vitamins, and that's vitamin A, D, E, and K2. That does the heavy lifting. EPA DHA, which I take no less than 3 grams of EPA DHA fish oil a day. When I'm feeling run down or want to work out harder, I'll even go up to 4 to 6 grams. Glutathione in reduced form, and we'll talk a little bit about that. Probiotics, good healthy gut biome, and then short chain fatty acids. Now, probiotics get so much attention, and they always are the headliner. They should be the opening band. When you fiber feed probiotics with blueberries and lettuce, et cetera, the probiotic eats those, and byproducts, or you could say like little micro mini poops out, short chain fatty acids, right? Short chain fatty acids in the literature help prevent colon cancer and colitis. So we'll actually do short chain fatty acid suppositories in CBD oil and coconut butter for ulcerative colitis flares. And it's just getting local short chain fatty acids will help common men. So helps prevent colon cancer and colitis. And when I see a precancerous polyp on a traditional colonoscopy or a virtual colonoscopy, they'll snip out the polyp. Yay, awesome conventional model, right? Conventional medicine doesn't suck. It's just limited, right? It goes like this. Super smart on a lot of things and goes like this. So why would you snip out a polyp and not go back and ask, why are you building colon cancer?
Why did it happen in the first place?
Why would we cut out a breast tumor and not go back and say, why is she making breast tumors, right? And we'll say genetics. What specifically genetics? Right. Genetics loads the gun, environment pulls the trigger. What's turning on the genetic expression of inability of your immune system to seek and destroy cancer cells, right? So we will do the Genova stool test, again, no royalties with them, and I will see short chain fatty acids and probiotic levels in there. And people who have precancerous polyps, or that we are the first responder on catching their colon cancers, because we literally force them to get a smart virtual colonoscopy or traditional colonoscopy. You don't need to overdo it, but it's a smart thing to do. And your colonoscopy, whether virtual or traditional, has gone back to 45 years old. It's not 50 anymore. So you got to do your first at 45. And the acupuncturists, the DOMs, the doctors of oriental medicines, and naturopaths, if you're not in a primary care role, you should be a dotting I's and crossing T's role, where you say, hey, let's get that virtual done by year's end, but we will see low and butyrate, one of the most studied short chain fatty acids, all the time in people who have precancerous polyps. So they're part of their gut immunity for prevention of precancerous polyps and colon cancers missing, right? First thing we do, hey, eat more vegetables, right? But if they don't have a good gut biome, they're feeding nothing, right? And then I'll use the Enterovite from Apex because it's a full spectrum short chain fatty acid product. So back to short chain fatty acids, prevents helps prevent, it's multifactorial, colitis and colon cancer, helps mend leaky gut. And this is where a lot of our SIBO cases or any of our gut cases are on short chain fatty acids to help mend gut lining. Helps metabolism, right? The Chubby Hubby study, it's an N of 1, but it was a skinny scientist who took poop out of her butt, shoved it up her chubby husband's butt, and he lost 30 pounds in 3 to 4 months doing nothing else. One variable change, right? He got skinny biome. I don't know if you ever listened to Ira Flatow on Science Friday, but he had on NPR, but he had the scientist in who did this with mice. He took obese bred mice, took their poop, stuck it in the skinny mouse's butt. Skinny mouse got chubby. Took the skinny mouse's poop, stuck it in the chubby mouse's colon. Chubby mouse got skinny. Then they cohabited them, and the skinny mouse biome won. The chubby mouse got skinny. So Ira Flatow was like, so should we have thin people cohabitate with chubby people, and chubby people get thin? And this is going to freak out our COVID moment here, right? But the scientist was like, yes, if no one washed their hands after they wiped their butt, and people shared toothbrushes, like you would a couple of mice in a tight space, right? So gut biome is so important for metabolism, and that's why sometimes you can see people's weight loss resistance started after a gut bug, right?
Right.
It could be just a simple enterovirus. It could be I went to Mexico and got Hep A, and pooped my brains out. It could be everything in between. So then the other thing short chain fatty acids do is they help modulate global immunity. So whether you have MS or Hashimoto's or lupus or RA, if your short chain fatty acids are low, we are going to supplement your short chain fatty acids, get your gut biome right, and then fiber feed you. If you're SIBO, we're going to do FODMAPs temporarily, but FODMAPs is a therapeutic diet. It's not a maintenance diet. You can't do that forever. Yeah. Got to get to a reestablished gut biome and fiber. It's essential. And heals leaky gut, metabolism, global autoimmunity, and then it's colon fuel. So your colonocytes use short chain fatty acids to motile, to do anti-cancer operations. So it's a localized way to make ATP for the colon. So I also think short chain fatty acids with any constipation, right? Now again, constipation is always multifactorial, but those are the big 5. And if we plug that into COVID, right? So this is where we don't have enough big picture thinking on these crises. I was listening to Rhonda Patrick on Rogan, and she was doing a good job promoting the vitamin D, right? So, but I want you guys to see this. This is actually from Apex. It's a poster I got to go home with, and I took it to the poster shop because I just loved it. And it's all about overwhelmed, feeling out of it, kind of food and environmental stresses are impacting your immune system, right? And it's really about, hey, think about food sensitivities, food intolerance, food allergy, 3 different branches of how food can mess with your immune system or vice versa. But what I like about it is it's just a good way to explain the immune system. And I want to thank Cheryl Berman, my immunology teacher at Bastyr, for really, I go back to that notebook, she taught us right. It was just over my head. I was drowning in overwhelm. Datis Karazian really helped me circle back around with my immunology notes and really lock it down. And Dr. Ari Vojadani. And then Dr. Shoemaker later, through Biotoxin Pathway, brought really wild connections that I launched from those guys. And then Dr. Bill Blanchette for how the immune system drives heart attack and stroke. But here's how it goes. In an ideal world, you see an antigen, let's say the COVID. Antigen just means protein. So protein code on anything. You have proteins, food has proteins, chemicals have protein chemical complexes called haptens, which is usually your own albumin with mercury to do this, to trigger this. But there's what we should be using this for, which is microbes, right? Parasite, bacteria, fungus, viruses, right? So the antigen is presented by the antigen presenting cell. And those are also called dendritic cells. and they line most of our services. So especially in the gut immunity, we have antigen presenting cells, dendritic cells, that just grab this and say, gluten, frankenwheat, attack it, right? And gluten's like, I know they did weird things to me in a lab, but I'm just a food source, don't attack, right? And that's the antigen presenting cell taking it to the T effector cell. And then these Tregs, these T regulating cells say, how hard should we attack? Should we leave it alone? And yes, we should. Patients ask me sometimes, like on a Hashimoto's antibody test, how come there's a range of 0 to 34? And that's because it's normal to sample every single tissue in your body. Your antigen presenting cells are going to go, okay, let's check. Oh, it's just a thyroid, moving along here, right? And when those antibodies go, we've seen them as high as 800, right? That's, you severely mistook the thyroid as an infection. You made an immune mistake that we call loss of immune tolerance. So the Tregs are really what make this decision here of, should we move into making antibodies and then tag the immune system, tag the virus, or should we lay low, right? And when it's self-tissue or a food source or even a chemical, lay low, take the chemical to the liver and poop it out, right? But what we're doing with these antigen presenting cells is we take COVID and we're going to say, yes, we're going to attack. So the first thing that happens is an overzealous immune response comes out. And I call that the army. We're throwing grenades. We're using bazookas. We're blowing up some of the enemy, but we also blew up a school, right? Then this is your central intelligence agency here, these T regulatory cells, that says, yes, this is a bad guy. Let's tag them. We can use the example. It's an intense example, but it's honest. We can say the CIA says Osama bin Laden's right here. Okay. Is Osama bin Laden dead yet? No. We just know where he is, and that's the CIA. That's what the Tregs do by creating antibodies to tag that. Then the Navy SEALs are cytotoxic T cells, and our natural killer cells take the shot. So what we're trying to do with COVID is this very clean tag and destroy. Tag and destroy. And for an average virus, it takes 4 to 7 days to do that. So the first 4 days are miserable. That's not COVID. Viruses want to stealthily take over your cells, replicate itself until you, the host, dies, and then find another host, right? And that's where we have fever, achiness, chest tightness, exhaustion. That's not COVID. That's your immune system's response to COVID. That's very generalized army approach, throwing grenades, bazookas, shooting into the woods in the dark, right? By about day 4 on average, in Chinese, it was day 3 to 5. And I want to be clear, when you read literature on Chinese, that's not Caucasians, right? If you're Chinese American, you can apply that to you, right? In our clinic, we did 120 COVID tests. People are showing up antibodies way later than 3 to 5 days, like the Chinese study says, right? We're seeing more in our bolder, lily white Caucasian population, more like 7 to 14 days before antibodies start to show up, right? And that's a race for, can you keep your immune system working but organized to not die of COVID, right? And the place we're going to modulate that is through T regulatory cell function. This is the general that says, how ballistic do we go? How long do we wait for the CIA to give us good intelligence on location so we can take clean shots that don't leave a lot of collateral damage? Collateral damage would be ARDS, acute respiratory distress syndrome, where I'm destroying my lungs from an overzealous immune response. And the 5 things that modulate T regulatory cells are fat-soluble vitamins, A, D, E, and K2, right? EPA, DHA fish oil, probiotics, short-chain fatty acids, and glutathione. Okay, so what we were...
I love that you're putting it all together. And so when it's in the lungs, so,
Mhm.
and how do we, because we just talked about how to keep our guts working optimally, and our immune system, but what can we do to sort of keep our lungs strong so that
Yeah.
if we do get this and it does go to our lungs, are there things that we can do in advance,
Yeah.
just to, in addition to doing those things, that would be helpful in your experience?
Yeah, and you're asking a really good question, but I want to switch the verbiage. What can we do to keep our immune systems balanced?
Mm-hmm.
You need a COVID hospitalization because of an overzealous innate immune response. Immune markers like IL-1, IL-6, tumor necrosis factor alpha, interferon gamma have all gone overboard, Chicken Little style, was saying, COVID is falling, COVID is falling,
Which is
COVID is
the
falling.
cytokine storm, correct?
That's the cytokine storm, right? You and I just answered your question. You are on fat soluble vitamins, vitamin D to correction, right? We shoot for vitamin D, 25 hydroxy vitamin D of 70 on lab. On average, that takes in Boulder, Colorado, 320 days of sunshine a year, 50,000 to 100,000 IUs of vitamin D per week. That costs my patients 25 cents a week.
Wow, it's a no-brainer.
No brainer. So what Rhonda brought on Rogan's show, which was great, was just where we're seeing these vitamin D deplete regions had strong rates of corona, and we know that vitamin D works very multifactorial. Early in this crisis, I put out, I want you all to make sure your vitamin D is tuned up. If you were working with us already, I already have you taking it to 70, but if you got lazy or forgot, get back on your 50,000 IU a week, right? And I had a patient send me really sharp guide article by John Masterson, and John Masterson saw in animal trials that vitamin A and D were upregulating the ACE2 receptor, which is the receptor that everyone's talking about and people being concerned about being on ACE inhibitors, a class of blood pressure medicines.
Mm-hmm.
And I just didn't feel, it wasn't a human trial, right? I just didn't feel like vitamin D was going to lose. And the reason is because of all of the ICU studies. So from my colleague Blanchette, who helped me figure out how to prevent heart attack or stroke, he showed me numerous studies that shows vitamin D lower than 12, lower than 11. There's a couple studies. Those, if you get admitted into the hospital and you have a vitamin D less than 11 or 12, you have higher rates of mortality in the ICU for every single condition known to man.
Wow. Wow.
So I used to ride with the ambulance, and when we drop you off, they're going to pull a CBC and a CMP and see where your organ function tests are, kidney function, liver function, etc. Why don't we pull a vitamin D and put that person immediately on 100,000 IUs of vitamin D a week? Literally, well, I know why. Money. It's going to cost us $1 a week.
Wow. Yeah. That's
With federal money and bulk buying, that 33 cents a week is going to kill us.
yeah.
You know, why don't we spend trillions instead on the back end propping up small businesses, right? So the problem we have is the T regulatory cell function is very broken in your average American. So let's go to the 3 highest causes. What comprised about 90% of New York's COVID cases on pre-existing conditions was hypertension, cardiometabolic, prediabetes or diabetes, right? Or what we could also term insulin insensitivity and obesity, right? Low vitamin D drives all of those.
Sure.
Vitamin D is necessary for insulin key and insulin lock to work so you don't go diabetic. Vitamin D is necessary to modulate your blood pressure, partially because it's an ACE2 receptor binder. Vitamin D is essential for metabolism and not having obesity, right? Show me someone in the equator from the Congo jungle who's chubby,
Yeah.
right? So vitamin D is implicated. The other thing, and this is a curiosity statement, is I wish all we had to do is pull vitamin D on all these people. And then we would have a phenomenal data point. Now, again, you could intervene immediately and give vitamin D, get it to correction. Range is 30 to 100 on most labs. We like it at 70. But apnea is another thing that causes hypertension, that causes obesity. Weight loss resistance can be caused by sleep apnea. And another thing that causes insulin insensitivity and subsequently contributes to type 2 diabetes. So I'm also curious how many people were apnics, because then they're hypoxic, they're low oxygen, all night. And remember, you can snore and not have apnea. You cannot snore and have apnea. Apnea can look like this. One-third of all apnea patients are skinny. One-third. 1 out of 3.
So if someone's listening to this or watching this and they think they might have apnea, is that something that you could help with them over telemedicine, or is it something that you can only do in person? Because I think that's a lot more common than we think. And is that something they can reach out to you about?
Yeah. So we do a 10-minute free new patient consult, potential new patient. And I have 3 criteria on that phone call. It's free, it's 10 minutes. We ask people to be respectful at that time, so I'm not leaving paying patients hanging in the room. But I do that because about 50% of my practice flew to us initially, and then we do follow-up over telemedicine. But we do that because I want to make sure I'm good at what you're coming in with. If I don't feel that gut check of I am highly likely to help this person, I don't want to see you, right? And straight out of the gate, what I don't do is oncology. I do not take cancer patients. I'm the first responder, quote unquote. I'm often the guy who found a cancer, found I think 5 or 6 thyroid cancers in my 20 years, handful of breast cancers, 4 colon cancers, 2 of which didn't take my recommendation of a virtual colonoscopy 5 years prior. And then I said, you have to do this. You have to do this. 1 out of 3 centimeter mass, the other out of 5 centimeter mass. So we're not scared of cancer and understanding it, but if I diagnosed a cancer in you, you're going to go to an integrated doc with a conventional oncologist to work together to do that, you know. But autoimmunity, headaches, mold, Lyme, sleep apnea, dental, we basically take on any other unresolved scenarios. But sometimes people say, I like the way you think, and I want you to be my integrated doc for this breast cancer moment. My colleagues who are good at that, they've spent 20 years just doing cancer, right?
Yeah. And one of the things, you know, I actually did fly out to Boulder to see you. I met you at a functional endocrinology course that you taught through Apex, and my in-laws are in Colorado, so it was a no-brainer. And I remember going through the paperwork, which was quite extensive, and my paperwork's also very extensive. And I think there was something about like, do you agree to like massively change your diet? Like, I think there was something in the screening, which I actually really liked, because I kind of feel the same way. It's like, I only want to work with people who want to show up and do the work to, like, I don't fix people. You know, I want to help discover what's happening and help you on your journey. But if you're not willing to meet me, and I think you do that as well, correct?
Yeah, and what I love, I mean, you're a doc, and what I love about the root of doctor, docere, means to teach, right?
Exactly.
So it doesn't mean to heal, right? So we can teach you how to heal, but only in my world with a proper diagnosis. And a diagnosis in our clinic is about 2 to 3 pages long and explains why you have what you have, right? In naturopathic and holistic model and conventional model, we're always calling what you have a symptom is your diagnosis, right? Like migraine, chronic fatigue syndrome, or and we want to we want to figure out why you have it. And if
Right.
you do a 2 to 3 page diagnosis, a monkey could do the treatment plan. So easy to do the treatment plan once you know what's up. That's where the fun begins. If you're not willing to embrace the grind, you're not going to get better. And here's my rule. If you're doing the treatment plan and you're not getting better, that's my problem. I'm going to put my kids to bed. I'm going to be studying Amanda's chart and figuring out Amanda's working her ass off. Why is she not getting better? This is going to drive me crazy, right? If you're not doing the treatment plan, then I'm going to be off in Tahiti with my snorkel, enjoying my family, my personal life, right? And it's not that I don't have time for it. It just gets murky in regards to the science. With a diagnosis, we're trying to control variables in a profoundly multivariable, multifactorial system, systems on top of systems on top of systems. So I'm screwed if you're not doing the things we know are in the way, what we call obstacles to cure in naturopathic medicine, or obstacles to healing, and adding in what a body needs, right? Like, again, EPA, DHA, fat-soluble vitamins, glutathione, gut biome, short-chain fatty acids. These were all intact in indigenous, right? This is your God-given physiology. This is natural law. And segregating from Mother Nature, even though I've given my own naturopathic kids penicillin or amoxicillin for strep, the first dose of antibiotic I gave them, I changed their gut biome forever, right? And I knew as an ND, I got to retrain that gut biome, get it back. So when I fiber feed my kids, they make short chain fatty acids, nice poops, modulate their immune system. So that's what we do. And for telemedicine, we are taking on new patients from afar, but we do expect that they need to come see us one time in the next 6 to 12 months, depending on how this is going. But our rule pre-COVID was, you come out once, we look at everything that's ever been done, all imaging, all, I want to hear what other practitioners are thinking. Sometimes, like you, a solid practitioner will send me people. And I love seeing you like got through inning 6 and we're just going to finish inning 7, 8, and 9.
Yeah.
Apnea can totally be 7, 8, and 9. Right.
Yeah.
And the reason we now do apnea in our clinic, and there are some awesome sleep doctors out there, and I want to just say that, and they handle some high complexity stuff. You have to be obsessive a little bit to get through apnea with a patient. But there is a 30% compliance rate of CPAP with people diagnosed with apnea. So the lucky ones who got to diagnosis in a sleep clinic, 3 out of 10 are actually following through. And that's because of the education, the inability to fits and fuddle with dials, really work with them on what mask works for them. Didgeridoo will heal apnea with circular breathing, but you have to play it 15 minutes a day, every day religiously. And usually a new apneic is too freaking depressed and tired to follow through with that practice. So sometimes we'll start with CPAP, get them oxygenated, and then get them going. We learned that the hard way. Like I was like, yeah, just play didgeridoo. And then no one did it. Because they're all too
iBobbin. So challenging to play.
Yeah.
I just wanted to try it. I ordered on Amazon and I thought it was going to be, it's huge. It's like taller than me.
It's humbling. Yeah.
So I think, all these things that you mentioned, it's really bringing down the body's, boosting up the immune system and lowering systemic inflammation. So if you're doing those things, I would assume you're more resilient. So if you do come in contact with COVID, your immune system would be strong enough just to move it through, like that it wouldn't take over.
Yeah. So here's a couple of things that we can kind of close out a day with, right? Like those 5 are intact in all of my autoimmune cases, all of my biotoxin cases, apneic. So a lot of our patients, especially ones like saw us 3 to 4 months before COVID, we're psyched because they got corrected, right? Their T regulatory cell function. So, it's the Kenny Rogers, got to know when to hold them, know when to hold them. It's what your immune system doing all day is like, tag, don't tag, tag, don't tag, tag, don't tag. If I tag, how long can I get a Navy SEAL in here to take the shot and clear the shit out, right? Yeah. And if we don't tag well, that's called poor antigen presentation. And there are immune response genetics called HLA, or human leukocyte antigen, that we're going to find for COVID. But we already have that for mold. We already have it for Lyme. We already have it for Hashimoto's, Crohn's, celiac. Every single inflammatory thing we see has an HLA genetic predisposition. But genetics loads the gun, environment pulls the trigger. So if someone with celiac HLA never gets exposed to gluten, they're never going celiac. If someone with mold biotoxin HLA like me never gets, and you, that's right, yeah, welcome to the Dorninger tribe. If you never get into mold, that gene doesn't wake up, right? We're going to see HLA that don't respond well to antibody antigen complex from COVID. Those are the people we should probably be nervous about with a COVID vaccine, right? Because if they can't do a proper antibody response to the actual virus, they're probably not going to do a proper antibody response to an attenuated virus. And one of two things are going to happen. They're not going to make antibodies, and the vaccine won't work for that small subset, right? I'm not anti-COVID vaccine. I'm anti not understanding HLA and vaccinations, right? Mom is right. Timmy was different after the immunization. But the doctor is right that the predominance of the kids did fine with the measles shot, right? It wasn't the mercury. We already proved that. Mercury in vaccines did not increase autism rates relative to the non-mercury vaccine. It's the immune inoculation with the wrong HLA that's like this. It can't do bang.
It would be so incredible if when babies were born, if they could run like an HLA panel.
That's my dream before I die as part of the health board changes. If we can do a heel stick that shows us HLA and say, these 95% of the kids are good to go, vaccinate the hell out of them, you're not going to get adverse reactions. Make sure they have their T regulatory cells supported. Those kids should be on a teaspoon of cod liver oil, right, which is vitamin A, vitamin D, EPA, DHA. And these 5%, don't touch them. We're going to make autism wake up. We're not going to make autism. We're going to make autism wake up, right? So again, it's really interesting in that. And that's where I wonder if our grandma and grandpa, who used to have a tablespoon of cod liver oil every day, if they would have sailed through COVID as a society better, because it's high in EPA, DHA, fat-soluble vitamin, vitamin A, and vitamin D, right? A, D, turmeric, these things are antiviral and immune balancing. So it's really weird to be like an ass-kicking chicken and karate chopping things while you're actually totally zenned out at the same time.
Yeah.
Right. So that T-reg makes us like as a personal biological military, not kill one person more than we need to, and have minimal collateral damage. Right.
And with these 5 categories, if people just went and, purchase them through either Dr. D or me, because we have medical grade, we've done a lot of research on the best products, the most absorbable, without all the filler crap in it. But is there any reason where anyone would have adverse experiences with any of these things? I know with the blood thinners.
Yeah. And we price a very aggressive dispensary, and you're more than willing to get stuff from us. But if you find a good company online, that's fine, right? Our goal is not about COVID rates. They have to stop reporting COVID rates. They need to report hospitalizations and deaths, because hospitalizations are someone who's in a cytokine storm. That's an overzealous innate immune response. Remember that humoral is antibody tag and destroy, tag and destroy. Innate is Chicken Little running around your body saying, COVID, COVID, COVID. And that's IL-6, that's IL-1, that's tumor necrosis factor alpha, that's interferon gamma. And that's fine. The one thing that we do not high dose, and this is something I've made up from 20 years of clinical practice, is vitamin K2. And the reason is there are 2 blood clotting genetics, factor 2 and factor 5. Factor 2 is also known as prothrombin or pro-clot gene, and factor 5 is also known as factor 5 Leiden. Vitamin K, whether it's K1 or K2, vegan or grass-fed animal till slaughter, will drive the enhanced production of cloudiness. So in my new patient appointment, because I do so much autoimmunity and so much biotoxin illness and apneas and infection and so on and so forth, I want to know if it's safe for me to vitamin K2 load, and I will do prothrombin and factor 2 on almost everybody.
You did on me, and I actually have the genetic where I do clot easily. So
and that's yours to share with the world, not for me, because I take everyone's
I feel like it's like you're not alone. I have this weird.
No, but now that you share that, we can say, so for you, there's such an overlap of what vitamin D and K2 do. We just go high D on a scenario like that, right? And that's fine. Now there is one other thing that is miraculous and would probably keep everyone out of the hospital, and that's freaking Wim Hof breathing, right?
Yes.
Breathe in, let go. Breathe in, let go. There's no ego. There's we go, right? Let the cold be a teacher, right? My dad's native Austrian, so I can do a decent Dutch accent, but I know Hollywood's not calling tomorrow. So here's what Wim Hof did. Yeah, that's it, right. Wim will definitely outlive me, so I won't ever get to play him in a movie. So here's the deal. Records, blah, blah. He's amazing. YouTube something like Iceman, Wim Hof Vice episode for inspiration, and then just how to do Wim Hof breathing. And you'll see 100 people, including Wim himself, will teach you how to do the breaths. But it's really almost like a hyperventilating. I remember in soccer, we used to go at the bottom of stairs before we run upstairs to blow off lactic acid so you can run those stairs better. It was a very similar concept, but it's scientifically studied. So what he did is, he is a crazy man, a lovely, brilliant, freaking wild man. What he did was he, in a Dutch lab, injected himself with the bacterial endotoxin of E. coli, right? This is bacterial endotoxins are called lipopolysaccharides. If we want to induce leaky gut in a rat model, we shoot it with the bacterial endotoxin of E. coli, and that rat's gut goes. I know it's super sad. I always say grace before I read a study with rats. It's just, I can't deny how much we learn from those studies, but it's still intense. But the point is, they inject him with a bacterial endotoxin. Not a good idea. What you're going to get off that is leaky gut and a inflammatory cytokine storm. You're going to get the exact same cytokines documented in that little experiment as we're seeing in ARDS, in acute respiratory distress syndrome, right? So they pull these inflammatory cytokines on Wim, and they're low. They inject them with the bacterial endotoxin. We're expecting a cytokine storm on the blood draw. We're expecting fever and a headache. He gets no fever, no headache, and no inflammatory cytokines, right?
Wow.
So am I getting all weird? There it goes.
Yeah, you did. You look like like a phoenix.
Can you cut off internet if you're doing something hardcore in there? I got my editing love bug behind me. My 13-year-old creative chain.
No, you looked like it was like a phoenix painting. Like it looked really.
That's interesting because that's my son Phoenix. So
wow.
Yep. Yeah, good call on that one. So anyway, he does that and he gets no headache, no temperature spike, and no inflammatory cytokines. Now you could lie and say, I didn't get a headache, and you're like, boo! You can't fake out a thermometer and you can't fake out a cytokine blood draw. So they say, you're just some weirdo with a lot of brown fat. And he says, no, anyone can do this. I'm not your guru. This is your innate healing. It's very naturopathic. Stimulate the V, stimulate the vital force. So they get about 24 college kids, right? Healthy kids. And don't let your child sign up for this study. Just send them an extra $500 or whatever they need. But they teach half of them how to do Wim Hof breathing for 2 weeks, not 2 months, not 2 years, 2 weeks. And then they inject all of them with bacterial endotoxin of E. coli, right? Everyone should be pooping their pants, leaky gutting, inflammatory cytokines, headaches, temperature rises. As you would expect, the 12 untrained Wim Hofers, non-trained, non-Hofers, get headache, get temperature spike, and follow-up cytokine blood draw shows IL-1, IL-6, tumor necrosis factor, interferon gamma through the roof. The 2-week trained youngsters show no spike in inflammatory cytokines.
Wow. Wow. So do you feel like this type of breathing, I would assume it's activating the vagus nerve, correct? And part of what it's
we
doing.
don't fully know.
Okay.
We do know there's some relation to blowing off acid. There's some relation to hypoxia or overriding hypoxia.
Mm-hmm.
Freeze up a little bit there.
Yeah, it's great. It's fine. It's entertaining. We just got like a Salvador Dali over here.
Okay. Yeah, totally. But the point is I think we're still fully understanding the mechanisms why it works. But if you're hyperoxygenating your brain, you're going to get better vagal bundle function, right? Sure. You can, again, we didn't prove that, but I could theorize that for sure. But the point being, every single American should be doing Wim Hof breathing right now. And if it feels like overwhelming or weirds you out or is intense the first time you try it, then you're doing it right. Welcome to hard work, right? Welcome to tabbing, and the word body hacking is a little overplayed. Welcome to getting to know your innate healing responses, the ability to wake up your body's ability to take care of itself, right? So again, Americans are going to have low EPA DHA, low fat soluble vitamins, low probiotics, low short chain fatty acids, especially if you've been on a ton of antibiotics, low glutathione levels, right? And these are all the things we learned take care of the mucosal borders, the mucosal immunity, including the lung lining, right? So glutathione gets used up during lung inflammation, right? Glutathione is highest in brain, heart, lung, and liver. So if you have any pathology there, if you're concussed a lot, your reduced glutathione levels go down. You start to oxidize. You start to get, you start to rust and inflame, right? So these 5 plus the Wim Hof breathing, watch the K2 if your doc didn't check factor 2 or factor 5. K2 is in pasture raised animals, and the only vegan source for it is slimy natto. That's a really interesting bean curd you can get at most Korean joints. I'm not willing to eat natto. It's like soy boogers to the fifth, but you will get dedicated vegan to get their K2 through natto, and it's loaded. So is grass-fed beef to slaughter. So is pasture-raised egg, pasture-raised dairy, and so on and so forth. But those are the big ones. And then the last one is that I wrote down is zinc, right? We did see in vitro. In vivo means we tested it in the body, whether it's in an animal or a human. In vitro is more in the petri dish or in a test tube. And what we saw is zinc dampened the ability of COVID to replicate. When you gave more zinc, it dampened viral replication more. There wasn't a stopping point. The more the zinc, the more the viral replication shut off. When we added hydroxychloroquine, Plaquenil, with zinc, the viral replication was even more dampened. Zinc and hydroxychloroquine also have immune modulating capacity, right? My favorite drug for this is we'll use doxycycline sometimes with a rheumatoid arthritis patient because doxycycline turns down metalloproteinase 9 or MMP9. So what I'm saying is doxycycline is not only bacteriostatic, meaning it slows the reproduction of bad bacteria, it also is an anti-inflammatory. Right? So people don't understand hydroxychloroquine is an antibiotic, but it's also an immune modulating anti-inflammatory. And it also helps, zinc helps turn hydroxychloroquine into an ionophore, which means you get better absorption of hydroxychloroquine into the cells when it's with zinc. They're like Batman and Robin or Thelma and Louise.
I love that. And I think this is really a time to really, we have Chinese medicine, functional medicine, naturopathic medicine, and with Western medicine, we can all enhance everything. We can all work together to really combat this. And I
Right.
think it's really you and I, we get people's bodies as strong as possible. And then there's things that, the complementing the Western treatments as well. I mean, we need all hands on deck. And I think just getting your body as strong as possible and adding the things that Dr. D recommended, which I'll write those down and show where you can get those, is super important. And I love the breathing. I think also just keeping account that stress does impact the immune system in a negative way. So this is really helpful, but also doing breath work and some other yoga, meditation,
Yeah.
all of those things.
Few quick things on that. Wim just made it on Gwyneth Paltrow's Goop, and he worked with one of her employees on her severe anxiety in that episode. So that's another. And there is Wim Hof in the works for studying depression and anxiety. I get high as a kite off of Wim Hof breathing. I turn that frown upside down, right? Wim is also part of the medicine. He's very charismatic. His heart's in the right place. I think we were talking about words like earnest and so on and so forth. He has an interesting story as to how he stumbled upon the breathing in the cold. But don't be surprised if it's a little hard at first. Just it's about consistency, right? And then with the zinc, I want to qualify. Zinc on an empty stomach gives most people nausea.
That's awful.
So 30 milligrams of zinc is my starting point, always with adequate food. And if someone is having active cold and flu symptoms, I do 30 milligrams 3 times a day. The Orthodox Jewish doctor back east did the zinc with the azithromycin, Z-Pak, and hydroxychloroquine. I was talking to my MD buddy about this, and azithromycin blocks the clearance of hydroxychloroquine. So is it the azithromycin doing something, or is azithromycin simply enhancing cellular concentrations of hydroxychloroquine? We don't know, right? But if you put 2 drugs or a drug and a herb together, and either one of them prevents the clearance or slows the clearance, you just got more of that floating around your bloodstream, right? But that's why we call it roots and branches integrative healthcare, right? Because I don't think anyone's an idiot. If you got to pass your MCAT and get through conventional medical school, you're no dummy, and you've seen a boatload of patients. The problem is you can be limited in that drug for symptom model. If you're a naturopath, you can go, or an acupuncturist, you can get a little too woo-woo and hear something at a lunch table and bring it as gospel into your practice, right? And we need to do a better job in the functional medicine world at collecting data in our clinics and publishing. That's how we're going to influence mainstream care. And that's what we're going to be doing in the fall. I hired a wonderful new ND. She's been working with us behind the scenes for 7 years, but she just graduated last year. And she's been working a lot with data collection. And we want to start publishing on Thomas Edison's phrase, there's a better way, find it.
Love that.
Right?
Yeah, we talked about that because I have a degree in master's in research.
You're going to be involved now for sure.
I'm so excited.
It's so funny because you come off so Cali, kind of like hippie girl, and then you push on that cardboard cutout of the general store, and behind us is juggernaut of research background and the best of. I love when people have hardcore PhD research training and Chinese medical training.
Oh yeah, but the thing is,
you see in China, you see MD with acupuncture training, you see LACs with PhDs, you see this. You
have to, because the thing is, it's systemic medicine both ways, and as a functional medicine doctor, practitioner, and a Chinese medical doctor, I cannot only see one. I can see both systems as they work together, and it's so beautiful. And to also just, I think a huge part of what both of us do is that education piece. Like my purpose of this is like, if you understand the mechanisms of what's going on in your body and your immune system and your gut and these essential nutrients that were so depleted, it really empowers you. It's like I'm going to put my best foot forward and I'm going to be as strong as possible. So if this does happen to me or someone that I love, I know that it's not going to be that bad. You know, we can
Right.
push through it. Stay out of
Yeah, my goal is to keep people out of the hospital and obviously not dying at home, right? And that's through
right.
immune modulation and antiviral immune modulating stuff. So the other one we use a lot of is just a boatload of turmeric, 4 grams a day when you're inactive. And then for glutathione, I actually like Apex's AC glutathione, and I'll do 1 capsule twice a day on that. Even go higher. If you're a real crisis, IV vitamin C, IV glutathione, absolutely good things to get to. And then the last thing I'll say is the Kawasaki disease that we're seeing in some of these New York kids. If this bumps into anybody who has policy access, can we please pull EPA DHA fish oil levels, vitamin D levels, red blood cell glutathione levels, probiotic and short chain fatty acid levels off of poop in those kids? I guarantee you these are subsets of the population whose T regulatory cell function is not managed well. And that's why they're having these overzealous response. And the other thing we missed, and please, if someone hears this who has the power to do this, pull their HLA. What is their immune response genetics? Because we're going to freak out a whole society now with this Kawasaki disease, and freaking Anderson Cooper, love him, but he's just going to keep the wheels of anxiety and panic going because of this very small subset of children that are either a very unique HLA, don't have T regulatory cell function managed, or both. Right? Let's learn more about these kids. If you're an established asthmatic and eczematic, you got eczema and asthma, you're low EPA DHA. I bet the farm you're going to be low vitamin D. You're going to be depleted on glutathione. Every time you have an asthma attack, you wipe out your glutathione stores, right? So when we have these kids, we can do things, or any patients, we can do things to support T regulatory cell function so they do well. It's in their best interest, but then it's in the best interest of understanding who really is vulnerable and who should be in more of a long-term quarantine versus the rest of us who really need to get our lives going again, you know, and both sides are right? And that's where
That middle way.
it's just, you hang out with a critical thinker if they're not on a team, right? You want to be teamless, right? Or cheer for every team, right? You want to say, hey, I'm watching the Broncos, awesome. Now I'm watching the Rams, go LA. Now I'm watching Seattle, go Seahawks, because everyone has something good to bring to the table. And I think people who have government positions or stable jobs don't understand the plight of the small business American, and small business American maybe doesn't understand what public health's trying to do for them. And it's time for us to really get better at identifying who's higher risk through things like HLA, and start really doing things we did with that in ICU study on low vitamin D levels, high cause, increase in all-cause mortality for everybody, for everything, right? If you have D under 11, you're screwed if you go to the hospital and wind up in the ICU. Yeah. Right. So there's just, and these are pennies a week for every single American to do this. Yeah. $1,200 stimulus check could provide a week's worth of 50,000 IUs a D for 1,200 Americans.
Wow. This message has to be shared, because I think that the general population feels so disempowered and scared. And I think that there's lots of reasons to be scared, but you can really strengthen your system and the system of those that you love and come in contact with. It's about, we're here to educate you so that you can educate everyone that you love, so that we're all in this stronger. Totally. Super important. And yeah.
Awesome.
Thank you so much. And
I'm going to go jump in a cold river and do some breathing.
Oh my gosh, that's amazing. Wear your mask. Just yeah.
We
Just
do.
cut your face.
We ride our bikes and do
Yeah.
this. No one's around. People are
I call
around.
it like the headlights, like, when you have your brights on and then you just kind of like.
That's exactly what's going on.
Yeah. So
Yeah.
thank you so much for being here. You're just a wealth of information. You have a huge heart. You're helping so many people, and I look up to you so much. And I just thank you so much. It's just wonderful.
Well, the inspiring feelings are mutual, and we're just proud to know you. And I know you're really trying to, make California better in regards to access to full quality healthcare. And I feel like none of us can do it alone, right? We need armies of critical thinking people in health, in government, in business, and I have to make a living like everybody else. But if you're not getting results as a provider, if your patient population is not getting big gain a good percentage of the time, it's a real burnout. If you're expecting to win every single case and think, everyone always gets better, like an episode of the Brady Bunch, you're in the wrong job. Our world can really be depressing some days, but if we just see in every day more getting better and graduating from healthcare and getting back to their life, I'm all in, and I see you as one of the extensions of me, and vice versa. Well, and again, some of the TCM formulas you shared with me, super beneficial. I find Western herbal tinctures and Chinese herbals are what you go to if what we talked about today is not enough. So if Amanda's helping you with, and those things, I call them the Fab Five. So if you're doing the Fab Five, if you're doing your Wim Hof breathing, if you're going to bed at a decent hour, so on and so forth, we are using some of the Blue Sky CBD for real anxiety, people who can't kick the anxiety. But even without CBD, the endogenous cannabinoid system gets modulated through exercise, even more with singing. So there's a small pilot trial on singing. So just take time to have fun, and as things starting to lighten up, throw some horseshoes with someone. You got the blue horseshoes, they got the silver horseshoes. You can distance yourself. Like get back in a community that doesn't violate high concentrated wildfire spread of COVID, because we all need it. But if you're doing Fab Five and doing everything right, you're not getting better. Make sure you reach out to Amanda or myself or someone qualified to do aggressive integrated natural medicine to get you on the other side. And that for me includes IV glutathione and IV vitamin C, which we don't do currently in our office. But I start with my aggressive Western tinctures and some of the Chinese herbals we've talked about, and then I'll refer them out for an IV if things are really not going well.
Wonderful.
So,
That's wonderful. Yeah. And I would say that we're both health detectives with big hearts. So, we're here to help. And thank you so much. Enjoy your plunge in the.
We'll keep rolling. Yeah, totally. Be safe, everybody.
Yeah, thank you. Okay, I'm going to end the recording.
Talk soon.
Okay, bye. Thank you.